Welcome back, everyone. Today we are going to review Chapter 11 from Exploring Medical Language and explore the digestive system. In order to discuss the digestive system and learn about words related to it, we need to know what structures the digestive system encompasses. So digestion begins in the mouth. So we have the oral cavity and the nasal cavity. And then the nasopharynx and the oropharynx, which are the beginning, the top of the pharynx. Remember, the pharynx is a shared tube between the digestive system and the respiratory system. So we eat through the mouth in the oral cavity, then food moves into the oropharynx, down through the pharynx into the esophagus. From the esophagus, we have the stomach. Other things we can see here are the small intestine in the center, which is the duodenum, the jejunum, and the ileum. Then we have the large intestine, which is here. There's small intestine. Large intestine, we have ascending, transverse, and descending colon. And then we have the sigmoid colon, the rectum, and the anus. We're also going to look at some accessory organs that you can see here in this picture, but the next slide is going to show them to us a little bit more clearly. In this slide, we can see some of the accessory organs of digestion. So the largest organ here is the liver, and the liver is the largest internal organ in the body. It is the second largest organ, with the skin being the first and largest organ in the body. Situated underneath the liver, we see the gallbladder in green. And from the liver, we have the hepatic duct. From the gallbladder, we have the cystic duct. And those two ducts come together in the common bile duct to dump bile into the duodenum, which is the initial segment of the small intestine. The liver produces bile. Bile's function is to help break down fats in digested foods, and the gallbladder stores that bile. And then when you eat a fatty meal, bile is delivered through that common bile duct into the duodenum to help with digestion. We can also see the pancreas situated here, sort of in this curve, and then behind the stomach like that. The pancreas is a glandular organ. Most people know of the pancreas due to diabetes and how it produces insulin and glucagon to regulate your blood sugar. That is one of the functions of the pancreas and an extremely important one, but it is only about 2% of the function of the pancreas. The other 98% of the pancreas is releasing digestive enzymes into the duodenum. I just want to note, you can see the spleen in this picture as well. The spleen is not an accessory organ of digestion. It has to do with the immune system, but it's put here so that you have an idea of where in the body it lives. So if we trace the pathway of food through the body, we start in the mouth with ingestion. And like I said, chemical digestion begins in the mouth with saliva. We have some enzymes in our saliva that begin to break down food. And then we swallow through the pharynx, down into the esophagus, and down into the stomach. From the stomach, food that is beginning to be digested moves into the duodenum, which is the initial segment of the small intestine. From the duodenum, we move into the jejunum, which is the larger section or largest section. And then from the jejunum into the ileum, which is the terminal or end section of the small intestine. The ileum is going to dump its contents into the cecum, which is the initial segment of the large intestine. And here you can see the little appendix kind of hanging off the cecum. From the cecum, we have the ascending colon, the hepatic flexure, which is the name for this curve or angle in the colon here, the transverse colon, the splenic flexure, the descending colon, the sigmoid colon, the rectum, and the anus. Some combining forms having to do with the digestive system are ceco, which corresponds to the cecum, entero, which corresponds to the intestines, typically the small intestines, gastro, which relates to the stomach, jejuno, which relates to the jejunum, and recto, which relates to the rectum. There's another combining form that means rectum. See if you can think of it. All right, the answer is procto, as in proctology and proctologist. Here we have some combining forms having to do with the accessory organs of the digestive system that we just looked at. Appendo has to do with the appendix. Chylo has to do with the lips. Cholangio has to do with the bile ducts. Hepato refers to the liver. And steato refers to fat or a fatty substance. Let's move on to some disease and disorder terms built from word parts. Cholangioma, we can see oma is a tumor. Cholangio refers to the bile duct, so that is a tumor of the bile duct. Cholelithiasis, lithiasis is stones. Chole refers to the gallbladder, so this is stones in the gallbladder. Diverticulosis is a condition of diverticula, which are little pockets within the large intestine. Diverticulitis is something you may have heard of, which is inflammation of the diverticula. That can be very painful, give a lot of abdominal pain, diarrhea, such like that. Peritonitis is inflammation of the peritoneum or the peritoneal membrane. Steatohepatitis, itis is inflammation, steato is fat, and hepato is liver. So this is inflammation of a fatty liver. So this is where the liver has fat infiltrated into it, and then it also becomes inflamed. These disease and disorder terms are not built from word parts, so we can't break them down like we did with the terms on the last slide. So celiac disease is a disease of a severe gluten allergy. So you get sick anytime you are exposed to gluten. Crohn's disease is chronic irritation of the intestines, typically in the ileum, characterized by these cobblestone ulcerations and scar tissue on the inside of the ileum. Gastroesophageal reflux disease is where acids from the stomach are refluxing up through the sphincter that should be keeping stomach contents separated from the esophagus. So it's also more commonly referred to as heartburn. Irritable bowel syndrome is characterized by intermittent diarrhea, constipation, and abdominal pain. And typically it is a disorder that does not have an underlying cause that can be determined. So it's sort of a catch-all phrase for you have difficulty with diarrhea, constipation, and abdominal pain, and we don't really know why, so we call it irritable bowel syndrome. And last, we have ulcerative colitis, which is a disease characterized by ulcerations of the colon, typically also associated with diarrhea and abdominal pain. So many of these diseases, except for the gastroesophageal reflux disease, or GERD, they have really similar symptoms. So they have to be diagnosed through colonoscopy, endoscopy, blood tests, things of that nature. Some surgical terms built from word parts. We have abdominocentesis. Centesis, remember, is the removal of fluid from the abdomen. This can also be called or referred to as paracentesis. Cholecystectomy is the removal of the gallbladder. Gastrostomy, stomy, is creation of a hole into gastro is the stomach. Herniorrhaphy, remember rhaphy is suturing of a hernia, which is a protrusion of material where it does not belong. So you can have an abdominal hernia, an umbilical hernia, an inguinal hernia, where internal parts, even the intestines, can be poking through the outer layers of the skin. And then laparotomy, So a laparotomy is also called a ciliotomy. It is a surgical procedure that involves making a large incision into the abdomen to access the peritoneal cavity and examine abdominal organs. Some surgical terms not built from word parts include abdominoperineal resection, which is the removal of the colon and other distal structures through both an abdominal approach and a perineal approach. This surgery would result in a colostomy bag. Anastomosis, the plural being anastomoses, is the connection of two hollow structures together. So you can anastomose blood vessels, or you can anastomose two different ends of the small intestine or the large intestine, as they are hollow organs. Bariatric surgery is a sort of umbrella term for surgeries that are meant to induce weight loss. Hemorrhoidectomy is the removal of hemorrhoids. And vagotomy is the removal of certain branches of the vagus nerve to help reduce gastric acid production. Some diagnostic terms built from word parts. Cholangiography is an operative, or it's a procedure that occurs during a gallbladder removal or a cholecystectomy. Typically, after they remove the gallbladder, they inject a contrast media into the common bile duct and make sure that there are no residual stones left in the gallbladder or the bile duct. An esophagram is a study of the esophagus. Typically, this is going to use barium, so like a barium swallow, and then you'll have multiple images taken as the barium is swallowed and moves its way down through the system. A capsule endoscopy is where you swallow a capsule that has a video camera in it, and it takes video of your entire digestive system as it moves through over the next couple of days. This can be really helpful when there's bleeding in the system and it can't be found through endoscopy or colonoscopy, as it's very hard to reach through all of the small intestines with a scope. So the capsule endoscopy allows you to see all the way through the small intestine. A laparoscope is a scope that is used to perform a laparoscopic surgery, which is a less invasive procedure than an abdominal open surgery or the laparotomy that we were just discussing. And a sigmoidoscopy is similar to a colonoscopy using a flexible scope inserted through the anus. This one's specifically just looking at the sigmoid colon versus a colonoscopy, which looks all the way up through the colon into the distal ileum. Some diagnostic terms not built from word parts include abdominal sonography, which is an ultrasound of the abdomen, and you can visualize many of the internal organs through abdominal sonography. A barium enema, which is similar to the barium swallow, except that the barium is injected through the anus instead of being swallowed through the mouth, and this can look at the lower digestive system. Endoscopic retrograde cholangiopancreatography, ERCP. Now that is a mouthful. So an ERCP is a procedure that combines an endoscope as well as x-rays to help diagnose and treat issues with the bile and pancreatic ducts. It's used to evaluate obstructions, strictures, and some liver and pancreatic diseases. An upper GI series is also called the upper gastrointestinal series, and this is used to evaluate the esophagus, the stomach, and the duodenum. And the fecal occult blood test is a stool test where it's looking for blood in the stool that's not bright red blood. Bright red blood in the stool typically is from something in the very end of the digestive system, maybe a hemorrhoid or a fissure or something like that. If you have black tarry stools, that's typically from blood higher up in the system that is coming out through the stool, and the fecal occult blood test can tell you that yes, there is blood, or no, there's not blood. And if there is blood, it's typically followed up with a colonoscopy. I'm not going to play this video for you right now, but I do recommend, if you are interested in how these things work, that you go and take a look at this video. It's about 8 minutes long, and it shows the entire procedure for a barium enema so that you can get an idea of how that is done. Some complementary terms built from word parts. We have aphasia, which is difficulty or lack of the ability to swallow. Dyspepsia, which is difficult digestion. It can also be called indigestion. Ileocecal is pertaining to the ileum and the cecum, which is where the small intestine and the large intestine connect. Nasogastric is pertaining to the nose and the stomach. So on the next slide, we'll see a nasogastric tube, or NG tube, which is a tube that can be inserted up through the nose, through the nasal cavity, down the esophagus, and into the stomach to provide tube feeding or nutritional feeding to a person who doesn't have the ability to swallow. And then steatorrhea. Rhea means flow, steato means fat. So this is where you're having diarrhea that has a lot of fat in it. So diarrhea that sort of floats in the toilet, is very fatty and foul smelling, is called steatorrhea. Here's another video that you can choose to watch on your own. If you go to the actual slideshow that's posted in your class, you can access these videos. And this is showing you a nasogastric tube placement. Some complementary terms not built from word parts include ascites, which is a condition where fluid builds up in the abdomen or the belly, and it can cause swelling. So with ascites, sometimes you'll see old men who look pregnant. If it's something that comes on rather quickly and isn't just a beer belly, that would indicate that it is ascites. Emesis is the medical term for vomiting. Gastric lavage is where you wash out the stomach. Hematochezia is a condition where fresh blood or bright red blood passes during a bowel movement. And the term palpate means to feel. So we often palpate the stomach, the digestive system, through the outside of the abdomen. So it's part of the physical exam. And last, let's talk about a few abbreviations that we've seen today. So BE is a barium enema. FOBT is a fecal occult blood test. GRED is pronounced as a word, GERD, and that is gastroesophageal reflux disease. IBS is irritable bowel syndrome. And PEG, or PEG, is percutaneous endoscopic gastrostomy, which is a surgical procedure. I hope that you have enjoyed this short introduction to the digestive system, and I will see you back next time.